Hello and welcome to our video. Today, we're going to explore the powerful connection between vegetables and heart health. We'll discover how incorporating more vegetables into your diet can significantly reduce your risk of cardiovascular disease and promote overall heart wellness. Let's dive into this important topic together. The heart-vegetable connection. Vegetables are nutritional powerhouses that provide a remarkable array of compounds that benefit cardiovascular health. The American Heart Association consistently recommends vegetables as a cornerstone of heart-healthy eating patterns. This isn't just traditional wisdom. It's backed by extensive scientific research showing that diets rich in vegetables are associated with lower rates of heart disease, the leading cause of death in the United States. The protective effects of vegetables on heart health work through multiple mechanisms. They help regulate blood pressure, improve cholesterol levels, reduce inflammation, support healthy blood vessel function, and provide antioxidants that protect the cardiovascular system. In this video, we'll explore the specific vegetables that offer the greatest heart benefits and practical ways to incorporate them into your daily meals. The science behind vegetables and heart protection. Research from institutions like the Harvard T.H. Chan School of Public Health has consistently demonstrated that higher vegetable intake is associated with reduced cardiovascular risk. Multiple large-scale studies show that each additional serving of vegetables in the daily diet correlates with a significant percentage decrease in heart disease risk. Key cardiovascular benefits of vegetables. A blood pressure regulation. Potassium-rich vegetables help counterbalance sodium's effects, promoting healthy blood pressure levels. A cholesterol management. Soluble fiber in vegetables binds to cholesterol in the digestive system, helping to remove it from the body. An inflammation reduction. Phytonutrients in vegetables help calm inflammatory processes that contribute to arterial damage. A nitric oxide production. Certain vegetables enhance nitric oxide, which helps blood vessels dilate and improves circulation. A weight management. High fiber, low-calorie vegetables help maintain healthy weight, reducing strain on the heart. Or antioxidant protection. Vegetables provide antioxidants that prevent oxidative damage to blood vessels and heart tissue. According to Dr. Michael Greger, founder of nutritionfacts.org, vegetables may be one of the most powerful categories of food when it comes to preventing heart disease and promoting longevity. The evidence is overwhelming that regular consumption provides significant cardiovascular protection. Top vegetables for heart health. Leafy greens. Nature's cardiovascular medicine. Leafy green vegetables stand out as exceptional heart protectors. Research published in the Journal of the American Heart Association found that greater consumption of leafy greens is associated with reduced risk of coronary heart disease. Heart-healthy leafy greens include a spinach, rich in nitrates, potassium, and antioxidants that support blood pressure regulation. A kale, packed with vitamins K, A, and C, along with minerals that support arterial health. A collard greens, excellent source of calcium and fiber that helps maintain healthy cholesterol levels. A Swiss chard contains phytonutrients that help reduce inflammation in blood vessels. A arugula, high in nitrates that promote blood vessel dilation and healthy circulation. A beet greens provide nitrates, potassium, and antioxidants that support cardiovascular function. Dr. Caldwell B. Esselstyn Jr., Director of the Cardiovascular Prevention and Reversal Program at the Cleveland Clinic Wellness Institute, recommends consuming leafy greens multiple times daily as part of a comprehensive approach to prevent and potentially reverse heart disease. Cruciferous vegetables. Sulfur-powered protection. Cruciferous vegetables contain unique sulfur compounds that support detoxification pathways and offer specific cardiovascular benefits. Heart-healthy cruciferous vegetables include a broccoli, contains sulforaphane which activates NRF2, a protein that protects against oxidative stress. A cauliflower provides anti-inflammatory compounds that help prevent arterial damage. A Brussels sprouts, rich in fiber that helps maintain healthy cholesterol levels. A cabbage contains anthocyanins in red varieties that support blood vessel health. A bok choy provides calcium, potassium, and folate important for heart function. Research published in the American Journal of Clinical Nutrition has shown that higher intake of cruciferous vegetables is associated with less calcium buildup in the aorta, an indicator of healthier arteries. Root vegetables, grounding heart health. Root vegetables provide unique compounds that support circulation and heart function. Heart-healthy root vegetables include a beets, rich in nitrates that convert to nitric oxide, improving blood flow and lowering blood pressure. A carrots, high in carotenoids that reduce oxidative stress in the cardiovascular system. A sweet potatoes provide potassium, fiber, and antioxidants that support overall heart health. A turnips contain glucosinolates that support detoxification and cardiovascular wellness. A radishes may help lower blood pressure and improve blood lipid profiles. A study published in Hypertension found that beet juice consumption significantly reduced blood pressure, with effects lasting up to 24 hours. Allium vegetables, the heart's allies. The allium family offers potent compounds that protect cardiovascular health. Heart-healthy allium vegetables include a garlic, contains allicin which helps reduce cholesterol, thin blood, and lower blood pressure. Onions, rich in quercetin, an antioxidant that helps prevent plaque formation in arteries. Leeks provide camphorol, which has cardioprotective effects. Shallots contain organosulfur compounds that support heart health. Scallions offer vitamin K, essential for blood clotting and calcium regulation. According to research from the University of Alabama at Birmingham, garlic intake is associated with a reduced risk of cardiovascular events, showing particular promise in the areas of blood pressure reduction and cholesterol management. Special considerations for older adults. The American Geriatric Society notes that cardiovascular health becomes increasingly important with age, as heart disease risk increases significantly in adults over 65. For older adults, vegetables offer particular benefits. Antioxidant protection. Aging is associated with increased oxidative stress, which vegetables help combat. Blood pressure management. Many older adults develop hypertension, which potassium-rich vegetables help control. Medication interactions. Some vegetables, particularly leafy greens high in vitamin K, may interact with blood thinners like warfarin, requiring consistent intake rather than avoidance. Digestibility. Cooking vegetables thoroughly may improve digestibility for seniors with gastrointestinal sensitivity. Accessibility. Pre-cut or frozen vegetables may be easier for older adults with limited dexterity or energy. Dr. Mark Locks, Director of Geriatrics at New York Presbyterian Hospital, recommends that older adults aim for 2 to 3 cups of vegetables daily, emphasizing variety and color to maximize the range of protective compounds consumed. Practical ways to increase vegetable consumption. Simple starting strategies. The 50% plate rule. Fill half your plate with vegetables at lunch and dinner. Veggie and dip snacks. Keep cut vegetables with hummus or yogurt dip ready in the refrigerator. Soup additions. Add extra vegetables to soups and stews. Breakfast vegetables. Incorporate vegetables into morning meals with vegetable omelets or smoothies. Double the vegetables. When following recipes, simply double the called-for amount of vegetables. Cooking methods to preserve heart benefits. Steaming preserves water-soluble nutrients better than boiling. Sautéing Light cooking in heart-healthy oils like olive oil can enhance absorption of fat-soluble nutrients. A roasting brings out natural sweetness in vegetables, making them more appealing. A raw preparation preserves heat-sensitive nutrients and enzymes. A soup making creates easy-to-consume vegetable servings with high nutrient retention. Meal planning for heart health. A weekly vegetable prep. Set aside time to clean and chop vegetables for the week. A vegetable-based meal starters. Begin meal planning by selecting seasonal vegetables. A color diversity. Aim for 3 to 4 different colored vegetables daily for a range of phytonutrients. A frozen vegetable backup. Keep frozen vegetables on hand for quick meal additions. A gradual incorporation. For those new to vegetable-rich diets, gradually increase servings. Addressing common barriers. A taste preferences. Experiment with different cooking methods and seasonings. A cost concerns. Focus on seasonal, affordable options and consider frozen vegetables. A time limitations. Utilize pre-cut options or batch preparation. A digestive discomfort. Start with well-cooked vegetables and gradually increase fiber intake. A food waste worries. Plan usage for vegetables and freeze extras for later use. Heart-healthy vegetable recipes. Here are some simple, delicious ways to incorporate heart-healthy vegetables into your meals. Mediterranean roasted vegetables. A mix chopped bell peppers, zucchini, eggplant and onions. Toss with olive oil, garlic and herbs. A roast at 400 degrees Fahrenheit until caramelized and tender. Serve as a side dish or over whole grains. Heart protective green smoothie. A blend spinach, banana, berries, ground flaxseed and plant-based milk. Add a small piece of ginger for anti-inflammatory properties. Optional. Add a tablespoon of chia seeds for omega-3 fatty acids. Cruciferous vegetable stir-fry. A sauté broccoli, cauliflower, and bok choy in minimal oil. Add garlic, ginger, and low-sodium soy sauce. Serve over brown rice or with lean protein. Beet and greens salad. Combine roasted beets, arugula, and walnuts. Dress with olive oil and balsamic vinegar. Top with a small amount of goat cheese if desired. Hearty vegetable soup. Simmer carrots, celery, onions, tomatoes, and beans in vegetable broth. Add leafy greens like kale or spinach in the last few minutes. Season with herbs and a splash of lemon juice for brightness. The role of vegetables in comprehensive heart health. While vegetables are powerful heart protectors, they work best as part of a comprehensive approach to cardiovascular health. The American College of Cardiology emphasizes that dietary patterns, rather than single foods, determine heart health outcomes. For optimal heart protection, combine vegetable consumption with a regular physical activity, stress management techniques, adequate sleep, avoiding tobacco products, limiting alcohol intake, maintaining a healthy weight, regular medical checkups. Dr. Dean Ornish, founder of the Preventive Medicine Research Institute, notes that nutrition is an essential component of heart disease prevention and treatment, with vegetables forming a cornerstone of any effective cardiac health program. The evidence is clear. Vegetables are among the most powerful foods for protecting and strengthening your heart. By increasing your intake of leafy greens, cruciferous vegetables, root vegetables, and allium plants, you provide your cardiovascular system with a wide array of protective compounds that work synergistically to reduce heart disease risk. Whether you're currently managing heart health concerns or working to prevent future problems, vegetables offer an accessible, delicious, and effective approach to supporting your cardiovascular well-being. Start today by adding just 1 extra serving of vegetables to your daily meals, and gradually build toward making them the foundation of your diet. The information presented in this video is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Always consult with your healthcare provider before making significant changes to your diet, especially if you have existing health conditions, are taking medications, or have special dietary needs. Some vegetables may interact with certain medications or may not be appropriate for individuals with specific health conditions. Thank you so much for watching. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell to stay updated on new health and nutrition content. See you next time.